No, I asked Lee to come on today because he forwarded some information to me about Leronlimab. When you say what? Leronlimab, Leronlimab. I'm not a scientist. I got onto Google and I had Siri tell me how to say it. But Leronlimab, or Pro 140, this is something that seems, Lee, at least at the outset, might be giving us some promising results. What is it? How far are they in looking at it? And does this give us some additional hope?
Yes, and yes. So I reached out to you, Pat, because, I study COVID. It's ridiculous, the amount of time that I spend looking at things. And I watched the presentation on this drug. It's a monoclonal antibody. And it struck me because it is proving effective in people with renal failure and organ transplants who are immune compromised. Exactly. So I was thinking of you and dropped you a little note that said, hey, you need to know about this. So it's really pretty interesting. This is a medication that was originally created for use with HIV. And they're finding that it works in COVID-19 in some initial studies. There's a much bigger study that's underway right now. We'll know more about that in December. But the initial reports are really very positive.
Yeah, and that's really good. And part of the reason is because from what I've read, and I've not had the time nor the brains to dig through some of this to the extent that you have and with your understanding of it, but it seems to me that it is primarily the older, and primarily the older with some underlying conditions, and certainly the older with underlying conditions, if in fact we're talking about suppressed immune systems, that are really a huge part of these numbers of coronavirus. And if this drug has an opportunity to make that better, this might be a flattening of the curve beyond anything else that we've done or found. Lee, where are they in their studies on this and in their testings, and how much hope does this seem to perhaps offer?
Well, I'll put it to you this way. I think this summarizes it best. So a couple of intensive care specialists that I've been following are saying that if from all their exposure in treating COVID patients, they come down with the disease and fall into that critical category, they're telling their family members, this is the drug I want. So that speaks volumes to me, yeah. And so here's the deal.
I can tell you about Fords all day long, but if you see me on the street and I'm driving a Dodge, that kind of takes away from some of the credibility that I like Fords. You know, if a doctor says, hey, honey, if I get sick, get this one, this is the one I want, guys like you and I should probably pay some attention at least on what they're saying.
Yeah, and it'll be real interesting when the results of the double-blind, multi-center study come out. But the preliminary data is showing this. It works. There is something called CCR5 that acts like a magnet that draws immune cells from all over your body to your lungs when you have COVID-19 in the most serious cases. Not everybody, of course. These are the folks who are hospitalized and are really, really in tough shape. So what happens there is that we've talked about it before, right? The ARDS, acute respiratory distress syndrome. Right. Your lungs are filling up with immune cells that are recruited from all over your body to come and attack this thing. It's kind of an overwhelming response they call a cytokine storm. Well, what this does is it blocks that response. So if you are one of those patients for whom your immune system is starting to freak out, they can inject this, and it seems to be blocking that crazy response from the immune system that causes the biggest problem in this disease. So it relieves that cytokine storm. It also seems to relieve what they're calling immune system exhaustion. So your immune system is working overtime because of this virus and kind of burns out. Well, this seems to relieve that and strengthen your immune system a bit. It also seems to decrease the amount of virus circulating in your blood plasma, so they call that plasma viral load. That is reduced. And this is really interesting. One of the side problems we've been noticing with COVID patients is many of them are having blood clots. And so far, in all of the patients administered this drug, none of them have developed blood clots. So that's pretty significant. Yeah.
That's
and here's the big news for you. Remdesivir is, the drug that everybody has been talking about. But if you have a kidney problem, you are excluded from being able to use remdesivir.
See, and I was just looking at another article today, Lee, and they were talking to me in this article, trying to get the straight scoop on flattening the curve, and do we have to get down to zero and all of that, and come to find out that that if you take the people that are older, and if you take the people that have some compromised systems, and especially if you take the people that their problem has been with the kidneys, that's where a whole lot of the trouble's coming from. And remdesivir, I just read it over the weekend, what you just said, remdesivir, I couldn't take it.
Right. So this could be an option now that you have to be very, very ill. So right now, this medication is approved under emergency investigational use only. So each case has to go up to the FDA for approval. So it's a complicated process, and it's not going to be widely used until we get through more of these tests. But it's looking very promising. So that's great. And another good thing about this drug is, unlike remdesivir is an IV drug. This is an injectable, kind of like insulin. And so that makes it much easier to administer, much less expensive, much less problematic in a lot of different ways. So we'll be watching this one real closely. And it's called Leronlimab. And anytime, this is kind of a good education, anytime you see that MAB, the end of the drugs, we're seeing a lot of those these days. That's a class of drug called a monoclonal antibody, MAB, and that tells you a little bit about how the drug wants to work in your body.
Very cool. Yeah, so, and again, it hasn't been a huge pool of people that they've used this on, but of the people they've used it on, and again, folks, these are people that were rather serious, and they've had some really good results from it, from what they've done. Everything, nothing's set in stone yet, but it's been really incredible. I was looking at one patient that was treated from a different hospital in New York than when they were doing the testings and everything, but they put it on him, took him off the oxygen. He was actually discharged after receiving therapy with this drug. That's amazing, because the things that we've heard is, people that went on the ventilators, 10 out of 11 died.
Absolutely. And here's one that just blew my mind. They described 2 patients on ECMO, which is, that's where they take the blood out of your body to oxygenate it. It's called extracorporeal mechanical oxygenation, ECMO, and you are really, really, really on the edge if that's happening to you. And there are a couple of patients described as being on ECMO for as much as 30 days. 3 days after the administration of this Leronlimab, they came off ECMO, and one of them actually was able to then eventually be discharged. So that is remarkable. Now, again, lots of great hope here. We all hope this thing comes through as well as it appears it will when the clinical trials our results are released. But what's so important here for all of us, is knowing that there is effective therapy is going to make the decision on whether or not to have another lockdown in case of a flare-up, or if this thing swings back around in the fall like everybody says it is. If we can get enough therapeutics that are going to manage our patients so the hospitals aren't clogged with really sick, desperate people, that's going to reduce the pressure to have us all go through another lockdown and disorient the economy that much more. So even if you're not sick, this is important that these drugs are as successful as we hope they can be.
Yeah, well, and here's the thing, everybody thought hydrochloroquine was the one, then remdesivir was the one. Lee, it might be 3 or 4 different drugs using for 3 or 4 different groups of people in 3 or 4 different categories. One of them is not the magic bullet here.
You were right. And as a matter of fact, one of the tests they're doing with this drug is pairing it with remdesivir to see how is that going to work. They work in two different ways in your body, so they're thinking of hitting the virus from two different directions. So, yeah, it's pretty encouraging. I was really excited about this one. And again, when I saw that issue around the kidney patients, I thought, Pat needs to know about this. So that's why I reached out.
Yep. Hey, listen, because I tell you something, and another thing, too, kidney patients and people who have had transplants, I tell you what, we're becoming our own fraternity group because it's an ever-growing group, and, you don't understand it as not being in the group as much as people in the group. I mean, but when you find out, like, when I go out to Lutheran and I'm out there with everybody that's part of the transplant, whether they're in, or they've just done their transplants, there's winks and nods. I mean, you get stuff because you're in it. People not in it don't fully understand. I appreciated you, though, sending me that information. That was great stuff to know, and I think it'll be pretty amazing. But I appreciate it, and thank you. I will look for you again on Thursday, and then we'll really push up this and everything else that you're going to be covering on this coming Saturday's WOWO's Health Call. Okay, my friend?
Thank you, Pat. Take care now.